something huge just happened in global health policy. We're talking about the relationship between the United States and the World Health Organization, and, well, as of today, that relationship is officially over. So let's break down exactly how we got here and what this all means.
Okay, let's just get right to the headline. As of January 23, 2026, the United States is no longer a member of the World Health Organization. This isn't a threat anymore, it's not a proposal. According to reports from places like Reuters and the AP, the split is done. It's official.
Now, this didn't just come out of the blue. It was actually the final step in a process that began exactly 1 year ago. So what was the immediate fallout? How did people react to this long-expected departure? Let's start with the WHO itself.
The very first public word from the World Health Organization was one of, well, regret. They put out a formal statement expressing their sadness over the U.S. leaving. That's a pretty clear signal of just how big of a deal this is on the world stage.
Like I said, this didn't happen overnight. There was a very formal, year-long process that brought us to this point. So the big question is, what were the actual steps that made this official? How does a country even do this?
The whole path was laid out very clearly. It all kicked off on January 20th, 2025, when Executive Order 1455 was signed. That order started a mandatory one-year countdown, and a formal notice was sent to both the UN and the WHO. And as of today, that one-year clock has officially hit zero.
And during that year, there were a couple of key conditions that were at the heart of the whole discussion. Publications like the British Medical Journal pointed this out. First, that one-year notice we just talked about, and second, the requirement for the country leaving to pay any money it still owed the organization.
So we know how it all went down. But the much bigger question, of course, is why? What were the official reasons given for taking such a historic step? And how did the WHO respond to those claims? So what was the core argument here? Why did the United States administration feel like this was a step it just had to take? The official reasoning actually gives us a really clear window into their thinking. The official justification, which was laid out by the U.S. Department of Health and Human Services, really came down to 3 key points. First, huge criticism of how the WHO handled the very early days of the COVID-19 pandemic. Second, the administration claimed that the WHO just failed to make the kinds of big, meaningful reforms needed to prevent that from happening again. And finally, there was this push for more accountability and independence, with the suggestion being that the organization was maybe a little too open to political influence. So while the U.S. was pointing to specific problems, the WHO's public response was, well, a little more forward-looking. I mean, besides saying they were sad to see the U.S. go, the organization also said it hoped the door wasn't shot for good. They hinted at the possibility of working together again, re-engaging somewhere down the line.
But just when you think the story of the formal split is kind of ramping up, a brand new, totally unexpected chapter just opened. And this is a fascinating twist that makes the whole idea of a total separation way more complicated.
Okay, this is where things get really interesting. A report from Reuters dropped, and it said that at the very same time the federal government was making its exit final, the state of California made a pretty shocking announcement of its own, charting a completely different course. So, what did California do? It announced it wants to join something called GOARN. And to really get why that's a big deal, you have to know what GOARN is. It's basically a network, coordinated by the WHO, where all these different institutions around the world, universities, labs, health agencies, pool their resources to fight disease outbreaks together. It is a critical piece of the global health security puzzle. So just step back and look at this incredible contrast. You have the U.S. federal government officially walking out of the WHO, but at the exact same time, the state of California, one of the biggest economies in the entire world, is choosing to partner up directly with a network that's run by that very same organization. This has created a situation in global health that is frankly totally unprecedented.
So the big question this all leaves us with is this. As one of the most powerful governments in the world steps back from a major global institution, are we about to see new kinds of players, like states or maybe even huge cities, step up to fill that gap on the international stage? It's a question that could seriously reshape the future of how we solve global problems.